Hello and welcome to the final video talking you through the Britain Health and People topic for AQA, and this time we're looking at medicine and we're looking at surgery and public health in 1900s Britain. So, to get your knowledge understood and revised, watch it a few times just to make sure all the knowledge goes in, and then do go to one of my skills videos which got quizzes and also a question that you can be tutored through to get to top grade marks and learn all the skills and criteria for the different questions. You can also have a look at my revision guide, which has lots more questions and lots of revision card based notes within them. So now let's go over to the key content to learn it. So we're going to start with surgery first of all, and how surgery develops in this time. So there were problems still remaining from the great progress of the 1800s. So the 1800s had improvements to pain relief through anaesthetics developing, and also aseptic surgery started to develop, but blood loss remained a problem. People having longer surgery and were losing lots of blood, and they could still die of blood loss. But Karl Landsteiner realised there were blood groups. So people had tried blood transfusions before, but sometimes it was rejected, sometimes it wasn't. It was a bit of a mystery. But obviously Karl Landsteiner, realising there were blood groups, started to solve this. So now we can start as a people to start blood donations. By 1913, this was helped by realising that sodium citrate was an anticoagulant. This stopped the blood clotting into like scabs, perhaps, as you might imagine. So blood could be stored for longer in bags, for instance. And then during World War I, the first ever blood bank was created for O group blood. This could be used to help anybody with their blood, because O group was the type of blood given for anyone. Also, the government started organising blood donation services, and there was lots of blood storage. So the whole idea of blood transfusions became amazingly good because of the war. War also helped with X-ray machines. So by 1895, Wilhelm Röntgen had discovered X-rays. By World War I, X-ray machines were being used to see broken bones and find bullets and bits of shrapnel in the body. So surgeons didn't have to cut around trying to find things. They could locate exactly where it was and then remove it. And these X-ray machines were called mini Curies, named after Marie Curie for her importance with X-rays and radiation, for instance. So war also helped with pain relief. So by 1905, Novocaine had been developed as a replacement to cocaine, which obviously is a bit dangerous as a serious drug. And so Novocaine became a pain relief that was very common used during the war, First World War that is, and could be given to patients to reduce their pain rather than giving a big sort of general anaesthetic. And then during the First World War as well, Harold Gillies starts to develop the idea of sort of reconstructive surgery or plastic surgery. So from 1917, there were lots and lots of people with really severe facial injuries, and they obviously had survived the war, but they couldn't go through life with a big sort of major facial injury. It caused horror on peoples, and then caused these people to have very much a bad life, and they would hide away from people. So he developed an idea of growing skin over their face. So he'd create a skin flap by sort of cutting off a bit of skin and then growing it over the hole in the face, and then with multiple operations would then seal that hole up so that the person would really improve the way they looked. So this was an early form of reconstructive surgery. During World War II, this was improved by Archibald Muckendall, who happened to be Gillies' cousin. So he developed plastic surgery for serious skin burns. So RAF pilots often had very serious skin burns after crashing. They might manage to bail out their plane or emergency land their plane while the plane was on fire, but by the time they'd got out, they had serious burns. So he would wash the wounds regularly with saline solution and grow new skin over the burns. And these people became known as Muckendall's guinea pigs, but he was very successful in developing skin grafting and plastic surgery, that sort of reconstructive idea, even more. And then Second World War also helped development of penicillin. So we know this is a treatment, but it's really important to consider it as something for surgery, because when a bullet or a bit of shrapnel goes into the body, it's potentially dirty and it's carried bacteria into the body. So you want penicillin to try and deal with that infection in the body. Of course, when you're doing surgery as well, you're sort of cutting open the body. Bacteria still can get in, however careful people are. So having that penicillin after surgery really helps stop. And then going on to modern surgery, modern times. So with transplants developing after war, it's really important to remember this is like a combination of everything that's happened. We've now got we've got anaesthetics, we've got antiseptics, we've got blood donations, we've got penicillin to help afterwards. So all these things are combined now to mean we can do really complex operations like transplants. So the first kidney transplant in 1952, which is obviously the first ever transplant. By 1967, we could do a heart transplant, which is obviously massively complicated. Just an idea then of the teamwork required to do some of these complex things. So to do a heart transplant, needed a whole team of people. You obviously need the surgeon to perform the operation. We need anaesthetists to ensure pain relief and no overdoses or sort of underdoses, as it were, that person wakes up at the wrong time. You might have somebody like a perfusionist who monitors blood flow in the heart and ensures that that person's staying alive. It might be that you have to organise machines when you're doing a heart transplant to make sure the person still stays alive. And then going on to modern times, we've got surgery which is called like keyhole or microsurgery. So using mini cameras and mini tools to perform the surgery. So there is not huge amounts of scar tissue that could be obviously causing long-term problems for the patient. This minimises the damage to the body and leads to more accurate repairs. And modern scanners like MRI machines and CAT scanners really help to find the problems and improve things. So finally, maybe we could think about question 3 a little bit, and also there's a few factors here. So question 3 is our compare question, and we might want to compare Industrial Revolution surgery to 20th century surgery. So obviously we might, as a lower level answer, remember that there were big discoveries made in both times. So 1800s had anaesthetics and antiseptics, whereas the 1900s had blood transfusions and x-rays and scanners to help more accurate surgery. So some big improvements and discoveries. More complex ideas might go around factors, for instance, as an idea. So individual genius. So Lister realised carbolic acid could kill infections and invented a machine that improved this, whereas plastic surgery developed under Harold Gillies, or Christian Barnard led the first heart transplants. We're considering great works in that time, leading to great improvements. Communication, really, really important. So Louis Pasteur's germ theory helped Lister develop his aseptic surgery, whereas in the 20th century, surgeons shared ideas. Gillies' plastic surgery inspired Muckendo's work. And then war, it's been a big part of the 1900s. So how do we connect it to the 1800s? Well, we might think about Florence Nightingale improved surgery by ensuring that wards were clean, stop infection for people after surgery. We might consider that Pasteur and Cox, inspired by their rivalry due to the Franco-Prussian War, helped develop understanding of germs, which helped aseptic surgery. We could connect war from the 1800s to war in the 1900s, where we got Muckendo and Gillies work on plastic surgery. We've got penicillin as well, developed during the war, that stops infections also. So in the 1800s, treatments had made some rapid progress by understanding about bacteria. So now in the 1900s, it's the task to try and kill bacteria once they're in the body to treat the patient. So there's an understanding of vaccines and how they work from the 1800s, so we can develop more vaccines in the 1900s. But how to stop the bacteria once it's in the body and to kill it when it's in the body, that becomes the big question. So people like Paul Ehrlich start to hunt for magic bullets to kill bacteria when it's in the body. And he starts researching about Salvarsan 606, which killed bacteria but also could kill the patient. However, he realised that in small doses it could stop syphilis. So next, in 1932, Dominiak developed Prontosil. This could kill the bacteria causing blood poisoning. Dominiak proved it when his own daughter needed it to save her life. Then afterwards, we get penicillin was discovered, and then it mass-produced during World War II as the final wonder drug, the great magic bullet that was going to kill all bacteria. So after this, we start to get a pill-based culture develop in medicine, with over-the-counter pills and drugs available to stop bacterial infections. But how does the wonder drug penicillin develop? So penicillin was discovered by Alexander Fleming in 1928, and obviously the famous story of the spores coming into his lab and landing on his dish by pure luck and killing his bacteria on his dishes. He then realizes the great importance of this. He can't, unfortunately, work out how to do anything with it, so publishes an article in 1929 in the Lancet magazine. So you could then argue that the great geniuses of this story are Florey and Chain, who at Oxford University start to develop Fleming's work. So for 1937, they are trying to grow and experiment with penicillin. By 1940, they grow enough penicillin to test it on mice. They have an experiment with obviously a group of mice that are all given a disease, and some of them are given penicillin, and it saves them, thus proving penicillin kills the bacteria, does not kill the mice. 1941, they then have an experiment on Albert Alexander, a policeman who unfortunately has just a cut from a thorn, and this leads to blood poisoning, and he's dying in hospital. So the penicillin almost saves him, but they run out of penicillin and he dies. They do have one more experiment on a child called Johnny Cox. They save him, but obviously, unfortunately, he dies due to complications of his illness beforehand. But enough evidence has been gathered to go off to America to try and get drug companies to fund their work. So in 1942, Florey arrives in America to try and get his investment for penicillin. And whilst he's there, Florey uses penicillin to save a lady's life called Mary Ann Miller. This hits the national news, and lots of newspapers talk about this wonder drug, and the US government and pharmaceutical companies go on board with penicillin and start to develop it. Penicillin is so heavily funded by the US government, it's the second biggest funded project during the Second World War. The most expensive project was the atom bomb. By 1944, penicillin has been produced in so much quantities that all medical teams in the D-Day landings can carry penicillin. So the significance of penicillin, we need to think about this because it could be a question for question 2. So long-term impacts, penicillin became the main drug to kill bacterial infections. Importance, the British and American governments funded it, so it's obviously got very great importance. Short-term impact, the American government spent billions of dollars on it, and all soldiers, medical soldiers, had access to it by 1944. Today, penicillin is used around the world to stop infection. In fact, it's possibly overused, and we now consider the idea of, superbugs that are resistant to penicillin. And obviously, hundreds of thousands of soldiers were treated with penicillin during the war to stop infections. Surgery had improved so much that infection was now the big killer, rather than other aspects of the injuries, because surgery could save people really effectively, and it was the infections that are already in the body were the big killer. So penicillin could now save people from that problem. Okay, modern treatments then. So science continues to develop vaccines, obviously. So tuberculosis, 1948, measles, 1964. So huge amounts of diseases are stopped now through vaccinations, which the government supports by having vaccination programs in schools and for babies to ensure these diseases are eradicated. So, for example, by the 2000s, tuberculosis was eradicated in the UK. Modern treatments start to develop as well. So ladies who can't have children, IVF treatment is one example of the high-tech treatments that are developed. So by 1978, Louise Brown is the first IVF baby. However, some treatments don't work so well. So thalidomide is an example of a treatment that fails. It was supposed to help ladies with morning sickness in the 1950s, but it led to babies with abnormalities. And it's worth considering that DNA has been discovered, and this helps to do really, really modern treatments like cloning of and growing of organs, etc., for transplants. So what about similarities then between different time periods? So we've got the treatments of the Industrial Revolution, we've got the treatments of the 20th century. So factors are really important here. So government helps in both times. The Franco-Prussian War leads to the French and German governments funding Pasteur and Koch to develop their ideas around bacteria, and then the American government heavily funds penicillin in the 1900s. War obviously is linked to the examples above. It's the same example, but you could just call it war if you wanted to. Luck is important in both times. Jenner was successful with experiments with James Phipps for smallpox in the late 1700s, early 1800s, and obviously that led to funding in the 1800s, his lucky tests on the children. Alexander Fleming was lucky the penicillin had landed on his dish and he'd realised the importance of it. Individual genius, you've got Pasteur and germ theory, Koch and discovery of bacteria-causing disease in the 1800s. We've got Fleming. This lucky discovery led to Florey and Chain doing the great work as possibly individual geniuses making penicillin. And communication, really important. Germ theory in the 1800s. Fleming's article on penicillin in the 1900s. Articles on DNA leading to ideas of cloning in the 1900s as well. So finally, public health in the 1900s. So the big thing we got to consider here was the NHS. So how does the NHS develop as the big sort of cure for all that helps everyone with healthcare at the point of entry for everyone in Britain from sort of birth to death? So The journey starts in 1911 with the Liberal reforms bringing in the National Health Insurance Act. This meant workers and the employers paid into an insurance fund to provide healthcare for workers. But it did not cover everyone brilliantly. So women, children, elderly who typically didn't work didn't have healthcare cover unless their husbands gave up some of their healthcare insurance to support them. So therefore, healthcare was not totally effective through the Insurance Act. This was highlighted more when the Great Depression took place, where lots of people were unemployed as well. Then we get the Second World War, and the Blitz highlighted the problem even further. So people who went off to war would tend to be the men, leaving women, children, and the elderly behind, who tended not to have jobs and therefore didn't have health insurance. They were the ones suffering the bombing of the German Blitz, and so they were getting injured and they're having no health insurance to help them in the hospitals. So the government brought in the Emergency Hospital Scheme, which was free healthcare at the hospitals at the point of entry when they went to the hospital. So this was continued in the Beveridge Report. So this was the Welfare Report of 1942, which we'll talk about in more detail later. So this highlighted the need for continued free healthcare after the war. And the Labour government, which surprisingly had a massive landslide victory in 1945 against Winston Churchill's winning government, brought in the NHS, the National Health Service, and Anna and Bevan led this change in 1948. He did have some trouble though. The doctors were resistant to the idea because obviously with their private practices they made lots and lots of money. But Bevan won them over by giving them an NHS salary plus saying you could do private work on the side to top up your salary and use the NHS hospitals for this. So then let's go back to the start of the story again, back to Liberal reform. So how did the welfare state develop? So we've talked about the NHS developing, now we've got the wider welfare state to help people's lives. So the Liberal reforms in the early 1900s happened because they noticed a number of problems. Firstly, they noticed high infant mortality rates. So up to 16% of babies were dying still in some places before the age of 1 due to diseases, etc. The Burwell Report pointed out that many of the recruits were generally of poor health and malnourished. The 1903 Booth Report and the Rowntree Report in 1899 both pointed out that up to a third of the populations in the cities were living below the poverty line. And they talked about how there were key moments in people's lives where they really struggled. So when people were a child, there were lots of other children's mouths to feed within the family. It was a struggle. When people were young adults and they had their children, again, it was a struggle. When people retired or they were old, there was a lack of pensions, so they struggled. So they needed to bring in some reforms to solve this. So to tackle child death rate, they brought in a number of things. So there was 1902 compulsory training for midwives, so that midwives knew how to deliver babies better and then support mothers in those first, and give them advice, well, I suppose, in the first few weeks to bring up their babies in a better way. In 1907, all babies were notified to a health visitor, and a health visitor would do regular checks to ensure babies were cleaned and fed properly. In 1907, there were parenting classes for parents. They could learn how to clean things. Although we knew about bacteria, people were still not brilliant at cleaning, but cleaning babies, cleaning dummies, cleaning bottles, etc. There was bacteria all around and easily given to the children. So tackling poverty was another thing they looked at, so particularly bad health and poverty of the working class. So schools, they started to introduce hot meals for school children. So remember, all primary school children have to go to school by this stage, so all primary school children are getting a hot meal and free milk every day. In 1907, there was free medical checks for school children to ensure they were being brought up properly and also checking they were okay. 1909, labour exchanges were brought in to give unemployed people work. 1909 again, we got the old age pension set up for the first time. We've got the end of back-to-back houses being banned and better regulations for building houses. And then by 1911, we got National Health Insurance Act being brought in. Now, you can imagine all these things were very expensive. So actually there was a huge political change here. They had to have what was called the People's Budget and a national election to bring in the People's Budget. And it eventually led to the House of Lords losing power to the House of Commons. So a big constitutional change had to be made to get these laws passed. The First World War also started to impact public health as well. So the idea of homes for heroes became a common phrase. So the heroes returning home would be built great homes, the slums removed and great homes built. So during the 1930s Great Depression, one of the work programs for unemployed people was building homes and removing the slum clearances. So great homes with nice solid walls, fireplaces, indoor toilets, inside toilets rather than privies outside. These things were starting to be made. Then World War II brings in the Beveridge Report. So William Beveridge is a government official, and during the Second World War he writes the Beveridge Report, a summary of what he thinks should be the welfare state after the war. He wants to remove the 5 giant evils. So want, people not having enough money; disease, he wants the NHS; ignorance, he wants better education and free education for all; squalor, remove all the slum housing; idleness, ensure employment and jobs for all. So the Labour government of 1945 advocated this idea of the welfare state, and this helped them win a landslide election. Winston Churchill did not support this idea. So what's the significance of the Beveridge Report? Well, long-term impact. The Beveridge Report began the modern welfare state, including the NHS, free education for all, for secondary school children as well, lots and lots of help and benefits to help the poor if they were unemployed or couldn't afford their rent. So this set up the idea of help for everyone. Importance was all governments support the NHS and welfare state from this point on. Short-term impact. By 1948, the NHS began with healthcare for all, and pretty much by 1950, we had all children going to school until for secondary school age, and we have an aspiration for building lots of new houses. Over 1 million houses built in the 1950s. Loads and loads of short-term impacts. Today, the NHS provides healthcare for all, with up to 5% of the country's budget spent on the NHS. And obviously, welfare as well is a big part of the government's budget as well. So just think about the NHS in terms of size and scale. Obviously, welfare state impacts hundreds of thousands of people as well. But the NHS, one big idea to consider is that from the 1950s to 1970s and 80s, there's been a big change in the average life expectancy of people. In fact, you could say by the end of the Second World War, it's around about 50. And then by the end of the 1970s, going to the 80s, it was 70 to 80. So literally the decades sort of match with the age. It's an easy thing to remember. So in modern public health then, the government's got more and more involved. As I said, the government in the 1950s, they knocked down lots of the slums and damaged houses through the Blitz and built over 1 million new homes. And the war also continued the idea of rationing. So this happened in 1954 because Britain was giving a lot of its food away to countries that needed the food more than Britain, and people's health was improved. There was a huge reduction in sugar and fat in people's diets. So again, modern public health, we have a lot more use of the TV and media, and the government really gets involved in this as well. So TV ads about how to cross the roads, how to be safe were very, very common in the 1970s and 1980s. And the 1980s had what was the AIDS fear. So there were lots of adverts about safe sex and how to avoid AIDS that the government led in the 1980s. In schools, PSHE teaches students how to have healthy diets, teaches drug awareness, alcohol awareness, about healthy lifestyles. We've had improvement of school dinners as well. Again, thinking back to the early 1900s, free dinners for everyone. Now it's free dinners for people who are the poorer students, but the dinners are now more healthy, thanks to campaigns by people like Jamie Oliver, the famous chef. And also, government public health laws were common as well in this time, so smoking being banned in public places since 2007 to improve the health of the nation. So what about some similarities then between the two time periods, the 1800s and the 1900s, question 3. So government is obviously really, really important in both times. So government ended laissez-faire ideas in the 1800s with loads of laws coming in, and obviously the government is interfering even more in a positive way in people's lives. In the 1900s with welfare state, Beveridge Report, NHS, better homes, massive amounts of improvements. Communication, really, really important. So Chadwick's investigation in 1842 led to the Public Health Act. In the 1900s, we had the Booth Report, the Burwell Report, the Rowntree Report, the Beveridge Report, all helping people's lives. And of course, we had a massive improvement in both time periods in people's living conditions and in terms of people's obviously political situation. So although it sounds not very complicated, this could be a very complicated response to make, that people have inspired the change. So the different voting systems emerging in the 1860s led perhaps to working class votes, leading to the 1875 Public Health Act. And of course, the 1945 landslide Labour victory led to the welfare state. So you could say poor people's vote have led to a much more sort of socialist idea of fairness and the acceptance of the rich paying more tax to help the poor. So finally then, factors of change. So government, as I said, is a really important one. So public health improved due to the Liberal government or the Labour government and welfare state. Treatments inspired by government investing in things like penicillin. Wars really helped public health with Homes for Heroes and the NHS. It's helped surgery with x-rays, plastic surgery, blood transfusions. Wars helped treatments with penicillin. Communication has helped public health through TV campaigns and media. It's helped treatments, as Fleming wrote his article about penicillin. It's helped experimentation has helped treatments through experimenting with penicillin, for instance. Ingenious has helped with public health with Beveridge's report. Surgery through people like Gillies' development of skin grafting. Treatments through fluorine chain development with penicillin. You could also talk about the DNA team as well. Science technology really helps surgery with great scanning technology like MRIs, CAT scans, etc. So loads and loads of ideas there for each of the main themes. So have a good look through those and revise them carefully. Okay, so I hope that was really, really useful for you, and you can go through those a few times and revise them thoroughly and learn all those factors, significance and key examples. And then once you're confident, go to my videos and practice your skills, and do look out for my revision guides as well. So loads more videos around I've got and more to come, so do subscribe for more ideas and more help. Okay, bye bye for now.